The smell of jet fuel never fully leaves you. It soaks into the fibers of your clothing, your hair, the soft tissue behind your nose, and even years later, a passing tanker truck on the highway can drop you back into Bagram in under a second. Dex Holloway knew that smell. She also knew the smell of a sucking chest wound, of burned synthetic fabric fused to skin, of the particular metallic sweetness that meant someone was losing too much blood too fast. She'd spent 4 years as a combat medic in Afghanistan, learning to compartmentalize those smells, to file them somewhere cold and professional where they couldn't reach her. She thought she'd gotten good at it. She hadn't counted on the smell of motor oil and wet concrete at 11:47 on a Wednesday night in the R of Mercy General, Cincinnati. The waiting room was nearly empty. That was the worst kind of night. Not the productive chaos of a trauma surge, just the slow, grinding drip of the forgotten and the desperate. A man in a construction vest dozed in the corner, a wrapped hand balanced on his knee. A woman rocked a feverish toddler in a plastic chair, humming something tuneless and exhausted. Holloway stood at the nurse's station, charting a laceration repair she'd done 40 minutes ago, her lower back aching in a way that had become so constant she'd stopped registering it as pain and started registering it as weather. She was 31 years old. She had a master's degree, a combat service ribbon she kept in a shoebox, and $11,000 in credit card debt. She was 14 minutes from the end of her shift. The ambulance bay doors didn't open. The front doors did, which was wrong. Wrong doors, wrong hour, wrong everything. Holloway looked up. A woman came through the entrance, not walking, lurching, her shoulder hitting the door frame as she came through, one arm wrapped tight around her midsection like she was holding herself together by sheer pressure. She was young, maybe 22, dressed in a grease-stained mechanic's shirt with a name patch that read Tomas in red stitching. Her face was the color of old wax. Holloway was already moving before the woman's knees hit the linoleum. She caught her. Barely. The woman was heavier than she looked, dense with muscle that had gone entirely slack, dead weight folding toward the floor. Holloway went down with her, one knee cracking hard against the tile, her arms locking around the woman's torso. "I got you," Holloway said. "I got you. Look at me." The woman's eyes were open. That was good. The pupils were reactive. Also good. The problem was the blood. It was coming through the mechanic's shirt in a slow spreading bloom across the left side, soaking through the fabric with a particular darkness that meant it had been going for a while. "What happened?" Holloway said. "Shop press," the woman said. Her voice was remarkably steady for someone who was actively bleeding onto a hospital floor. Hydraulic line snapped. "Caught me in the side." "How long ago?" 20 minutes maybe. "I drove myself." Holloway filed that somewhere specific. The woman had driven herself to the hospital while bleeding from a hydraulic line injury, which meant either she lived alone or she was the kind of person who would not ask for help until the option of not asking was physically removed. Holloway recognized the type. She had been the type. "Okay," Holloway said. "You did the right thing coming here. What's your name?" "Bauer," the woman said. "Cass Bauer. All right, Cass. I'm Dex. You stay with me." She got Cass onto a gurney in Bay 2 with the help of the unit clerk, a 19-year-old named Felix, who was pre-med and perpetually horrified by blood, but who had learned to be useful in spite of it. Holloway cut the shirt off. The laceration beneath was a deep, ragged channel running diagonally across the lower ribs, still actively oozing, with a bruise forming around it in colors that didn't have good names. Nothing obviously eviscerated. Ribs intact on palpation, though Cass made a sound when Holloway pressed the fourth and fifth. "Those are cracked, maybe broken," Holloway said. "You need imaging. You need an IV and about a liter of saline, and you need a surgeon to look at this." "Okay," Cass said. She was staring at the ceiling with the concentrated expression of someone doing math in their head. "Is it bad?" "It's not good," Holloway said, which was honest. "But you're going to be fine." She started the IV line, found the vein on the first try, taped it down, and was reaching for the saline bag when the door opened. She assumed it was Felix with the imaging request. It wasn't. The man who entered was somewhere north of 60, wearing a pressed shirt and the particular kind of wire-rimmed glasses that administrators favored. His name was Delacroix. He was the night supervisor, and he had the expression of a man who had spent 2 decades making decisions about liability and had the facial muscles to prove it. "Holloway," he said. He looked at Cass on the table. He looked at the blood on the floor. He looked at the cut mechanic's shirt on the counter. This woman walked in through the front entrance, collapsed in the waiting room. Holloway said, not looking up. "Hydraulic injury, lower left thorax. I need a surgical consult." "She's not a registered patient," Delacroix said. "She's a human being who is bleeding." "Holloway." His voice had the patient, exhausted weight of a man who had said this before, who would say it again, who had a system and needed that system to be followed. "She needs to be registered, triaged through intake, assessed by the attending on call, and moved through protocol. That is how we protect the patient and the hospital. You cannot just drag people in off the floor and start treating them without." "She was on the floor," Holloway said. Her voice came out flat. She was pushing fluids now, watching the bag deflate. "Literally. I caught her before she hit. The protocol exists for a reason. The protocol wasn't invented for a woman bleeding through a hydraulic injury at midnight." Delacroix stepped fully into the bay and let the door close behind him. He lowered his voice in the way that people lowered their voices when they were about to say something that would not look good if recorded. "You have a history of operating outside established procedure," he said. "You know that, I know that, the attending knows that. This is not combat medicine, Holloway. You are not a field medic out here. You are a registered nurse in a licensed medical facility, and you will follow the protocol, or I will document this as an unauthorized intervention and have you removed from the rotation pending review." Holloway looked at Cass. Cass was still staring at the ceiling. Her blood pressure on the monitor read 89/58. That was bad. "Her pressure is dropping," Holloway said. "Then register her and get the attending. There's no time for Holloway." His voice went sharp. "Step outside, now." She stepped outside. The hallway was cold, the way hospital hallways were always cold. The kind of cold that seeped through cotton scrubs and reminded you that the building did not care about you personally. Delacroix followed her out, pulling the bay door shut behind him. Through the small window, Holloway could see Felix hovering near Cass's gurney, looking young and uncertain. "You need to understand something," Delacroix said. He had straightened to his full height, which wasn't impressive, but his voice carried the practiced authority of someone who had spent a long time being listened to. "Every time you deviate from protocol, you expose this hospital to liability. Every time. You create documentation problems, chain of custody problems, insurance problems. Your instincts may be excellent. I'm sure they were excellent in Afghanistan. But instinct is not a substitute for process, and process is what keeps this institution functional. She'll die if I don't. She will be attended to, through proper channels. He held out his hand. Give me your access card. Holloway stared at him. Your access card, he repeated. You're off the floor pending a review of this incident. I'll have someone from nights cover the rest of your shift. It didn't feel real. The words landed with the soft, blunt impact of something moving too fast to process. She had her rent direct debited on the 15th. She had a lease that didn't allow pets and a car with a cracked windshield she'd been ignoring since February. She had the specific, grinding financial math of someone who could not afford to be suspended. She unclipped the access card from her lanyard and handed it over. Get your things, Delacroix said, already turning back toward the bay. Security will escort you to the exit. She stood in the hallway. The fluorescent light above her hummed at a frequency that seemed specifically calibrated to make people feel bad about themselves. Through the window, she watched Delacroix lean over Cass and say something she couldn't hear. Cass turned her head and looked through the glass. Their eyes met for a moment. There was no accusation in Cass's expression, which was somehow worse. Holloway went to the locker room. She changed out of her scrubs with mechanical efficiency, the same efficiency she'd learned to pack a kit under fire, the same efficiency that had gotten her through 4 years of things that required efficiency, or else they required falling apart. She pulled on jeans and a gray thermal and laced up her boots without sitting down, because if she sat down, she was going to have to think about what happened. And she didn't want to think about what happened. She pulled her bag out of the locker and didn't look at the framed photo she kept on the shelf inside. Herself at 26, squinting into an Afghan sun, arm around another medic, whose name she still saw sometimes in her dreams. She walked back out to the main floor, and then she stopped. The lobby was not as she had left it. 3 men stood near the triage desk. They were not wearing scrubs. They were not wearing business clothes. They were wearing the specific, deliberately nondescript civilian clothes of people who were not trying to look like anything at all. Dark Henleys, cargo pants, trail runners with too much tread. And they stood with the absolute, unself-conscious stillness of people who had been trained to be still in ways that most people never needed to learn. They were not anxious. They were not scanning the room nervously. They were simply present in a way that made the rest of the room feel slightly less real by comparison. The oldest of them, maybe mid-40s, blunt-jawed, with the kind of weathered face that came from years of high UV environments, was speaking quietly to the charge nurse at the desk. The charge nurse, a woman named Pacheco, who Holloway had watched talk down a violent psych patient without changing her expression, looked distinctly unsettled. Holloway recognized the energy. She had last felt it in a forward operating base outside Kandahar, when a ranger assessment team had come through for 2 days and then quietly disappeared. That particular quality of controlled, absolute competence. The blunt-jawed man turned. His eyes found Holloway immediately, not scanning, not searching, just finding the way trained eyes moved. You're the one, he said. Not a question. Depends on the one, Holloway said, treated the woman who came in through the front, Bauer. Something rearranged itself in Holloway's chest. You know her. She's one of ours, he said simply. Holloway set her bag down on the tile. What do you mean, one of yours? The man studied her for a moment. His eyes moved to the absent access card on her lanyard. He looked at the bag. He looked at her boots, her hands, the particular set of her shoulders that Holloway had been told her whole career gave away the fact that she'd been military before she'd been anything else. What's your background? He asked. "68 whiskey," she said. 4 years, 2 deployments. Something shifted in his expression. It wasn't warmth exactly. It was recognition, the specific, wordless recognition of people who have been in the same kind of dark. Cass Bauer is a 3-year operative with a federal task force that doesn't have an official name, the man said, quietly enough that his voice didn't carry past the two of them. She was coming off a 7-month undercover assignment when she got injured. She has no current civilian identity on record anywhere, no insurance cards, no registered address. When she walks into an ER, the system flags her and she disappears into bureaucratic nothing unless someone with actual judgment takes over. "Someone took her access card," Holloway said. "We know. I'm suspended," Holloway said. "They're reviewing. We know that too." He looked past her toward the double doors. "Where is he?" She didn't have to ask who. "Administrative wing. Left side past imaging." The man gave a small, almost imperceptible nod and said something low to the 2 men behind him. They moved. Not rushing, not dramatic. Just moving with the particular economy of people to whom drama was an inefficiency. They disappeared through the double doors. Holloway stood there. 30 seconds passed. A minute. Pacheco was watching the doors like she was waiting for something to come through them that she didn't want to see. The doors opened. Delacroix came through first. He was walking quickly, the way men walked quickly when they were trying to appear in control of a situation they no longer controlled. His wire-rimmed glasses were slightly askew. Behind him came the 2 men, and behind them, the blunt-jawed man who had talked to Holloway, and he was carrying something. Holloway's access card, she realized, though she didn't understand how he had it. Delacroix stopped in the center of the lobby. He looked at Holloway. The resentment in his face was specific and comprehensive. "The woman in Bay 2, the blunt-jawed man said, and his voice had changed slightly. Still quiet, but carrying the quality of something that did not require volume to land. "She was treated by Nurse Holloway before your intervention. The intervention that Holloway performed was clinically correct, medically necessary, and saved that woman's life. You're going to need to make that right. I don't know who you think you..." Cassandra Bauer has 2 GSA file numbers, a commendation from the Director of Operations dated March of last year, and a handler who is currently on the phone with your hospital's board chair. The stockier of the 2 men said. He was looking at his phone in a way that was pointed. "You suspended the nurse who kept your federal liaison from bleeding out in your intake bay because you were concerned about process documentation. That's going to look very interesting in print." Delacroix's jaw moved without producing sound. "Your call," the blunt-jawed man said. He was patient about it. He was the most patient person Holloway had ever found frightening. Delacroix looked at the access card in the man's hand. He looked at Holloway. There was nothing generous in his face. No concession, no acknowledgement that he'd been wrong, no grace. Just the cold arithmetic of a man calculating which outcome was worse. He reached out and took the access card. He walked across the lobby. He held it out. Holloway took it. "Suspension is lifted," Delacroix said. His voice was clinical, empty. "Report back to your station." He walked away. He didn't look back. The sound of his shoes on the linoleum was small and tight, and getting smaller. The blunt-jawed man was looking at Holloway with the expression of someone completing an assessment. "Bauer told us what you did," he said. "Starting a line in the dark, going by instinct, not waiting for authorization you weren't going to get. That's the job. You know that's the job. I just didn't want her to die on my floor," Holloway said. "That's enough," he said. He extended his hand. She shook it. His grip was matter of fact. "Bauer's going to need real surgery," Holloway said. "Ribs are fractured. There's interior bleeding I couldn't assess without imaging. She needs a surgical team tonight." "We've got a team coming in," he said. 30 minutes. He looked at her steadily. "You want to be in that room?" She hadn't expected the question. She looked at the access card in her palm. The plastic edge was sharp against the lines of her hand. She thought about the procedure, the protocol, the documentation, the whole elaborate machinery that existed between an instinct and an action, and how sometimes that machinery saved lives and sometimes it was the thing that got in the way of saving them. "Yes," she said. He nodded once. "Then you should probably go scrub in." She clipped the badge back onto her lanyard and picked up her bag. She took it back to the locker room. She hung her civilian jacket on the hook. She washed her hands at the deep sink, the water running hot, the industrial soap cutting through the residue of the night. Through the window above the sink, she could see the parking lot, the amber glow of the sodium lights, a fine rain just starting to blur the asphalt. She had been 26, the first time she'd made a call under pressure that she wasn't authorized to make. A corporal with a severed femoral and a medical officer, 3 minutes away, who was 3 minutes too far. She'd packed the wound with her own kit. The corporal had lived. She'd been reprimanded. She'd agreed, formally and with paperwork, that she'd exceeded her scope. She had never once, in the years since, stopped believing she'd done the right thing. She dried her hands. She pulled her hair back. She looked at herself in the mirror above the sink, tired, a little wrecked, with the particular expression of someone who had just survived something that hadn't required courage so much as it had required stubbornness. She didn't feel heroic. She felt the way she always felt after things like this, empty, and underneath the empty, something steady and quiet. A foundation, the part of her that had made the call. Pacheco knocked on the locker room door without opening it. "Surgical team's here early, Bay 4. They're asking for you." "Coming," Holloway said. She pushed the door open and walked back out to the floor. The waiting room had shifted while she was gone. New faces in the plastic chairs. A paramedic crew restocking near the bay doors. Felix refiling charts with the focused energy of someone pretending they hadn't just witnessed something they'd be thinking about for years. The monitors beeped. The doors opened and closed. The ordinary machinery of the place reassembled itself around the extraordinary thing that had happened. The way water closed over something that had passed through it. Holloway walked to Bay 4. The surgical team was already setting up. 2 surgeons she didn't recognize, moving around the table with the economical choreography of people who had done this many times in many different rooms. Cass Bauer was awake on the gurney, blood pressure better now, the saline doing its work. Her eyes tracked Holloway when she entered. "You're still here," Cass said. Her voice was dry but not unkind. "Apparently," Holloway said. Cass looked at the badge on her lanyard. "They gave it back. They did." Cass was quiet for a moment. Outside the bay, through the small window in the door, Holloway could see the blunt-jawed man standing in the hall. Not interfering, not visible to the surgeons, just there, in the particular way that people stood when they were watching over something that mattered to them. "You didn't have to do what you did," Cass said quietly. "I know," Holloway said. "Most people wouldn't have. Most people's back didn't hurt this badly," Holloway said. "I wasn't in the mood to argue with my conscience." Cass almost smiled. It was small and painful, a smile that had to travel through cracked ribs to get to her face. "Get some rest," Holloway said. pulling on gloves. She looked at the lead surgeon. "Walk me through what you need." The surgery took 2 hours. The ribs were fractured in 2 places. There was a bleed along the intercostal margin that needed direct repair. There were complications, and then there were not complications, and somewhere in the middle of it, the night shifted from the bad kind of night to the kind that ended correctly. Holloway stood at the table and handed instruments and held retractors and did what she'd been trained to do, field and licensed together in the same set of hands 4 years of war and 6 years of hospital, condensed into the specific usefulness of someone who had learned things the hard way and kept the lessons. At 4 in the morning, she walked out of the bay. The surgical team was debriefing. The blunt-jawed man was gone. She found out later he'd left when it was clear Cass was stable, which was the kind of thing that particular kind of person did. No ceremony, no extended acknowledgement, just present when needed, gone when not. Holloway sat down in the break room and drank a cup of bad coffee. Through the small window above the counter, the parking lot lights were still amber. The rain had stopped. The sky in the east was beginning to turn the particular gray that happened just before it decided to become morning. Pacheco came in, poured coffee, sat down across from her. "You're insane," Pacheco said. This was a statement of fact, not a judgment. "Probably," Holloway said. "Delacroix's going to make your life difficult. He was already making my life difficult." Pacheco was quiet for a moment. "She's going to be okay? The woman in 4? "She's going to be okay," Holloway said. "Good." Pacheco drank her coffee. "That's the job, right?" "That's the job," Holloway said. She sat there until the light outside the window changed from gray to pale yellow, and then she finished her coffee, put the cup in the sink, and walked back out to the floor. There were new patients. There would always be new patients. The doors opened and closed and opened again, the way they always did, indifferent to the dramas that played out beneath the fluorescent hum. Carrying in the world's ordinary disasters one at a time. Holloway pulled on a new pair of gloves, snapping the cuffs over her wrists, and got back to work.